Welcome back. I'm the Intense MD, a board certified ICU doctor here to give you an inside look into the intensive care unit. One of the most common questions I get about end of life is what should I expect when you take away the life support? A lot of people worry about their loved ones suffering when we take away support. They also ask me how much time I think it'll take for the patient to die. There are different types of life support. Most commonly, people think about the ventilator, but there are also drips that help keep the blood pressure up, called vasopressors. There are also other things like cardiac devices, ECMO, continuous dialysis. So, what it looks like to remove life support depends on what the patient is requiring for life support. Usually, the whole process starts with a conversation with the family, and they'll say, we want to take the life support away and let them pass away naturally. We'll give the family, time to visit. Sometimes people come from further away and need to drive in. So we give them time with the patient, and when everybody's ready, we start the process. So we'll turn off all the drips, we'll take out the breathing tube from the ventilator, and if there's any other support devices, we turn those off as well. Many times prior to taking the breathing tube out, we'll give a medication to ease their breathing so it doesn't look like they're gasping for air. Many people ask, since the ventilator is supporting their breathing, are they going to have difficulty breathing and struggling to breathe once we take that away? We try to eliminate this issue by pre-medicating before we take the tube out, as well as continuing to monitor for signs of pain or struggling to breathe or anxiety. And we give medications to treat each of these things as needed. So we want to keep the patient as comfortable as possible while they are passing away. In terms of how long it takes, that also depends on the patient and how much support they're on. If somebody's needing multiple medications to keep their blood pressure up, I usually tell the family I don't expect them to be alive for more than a couple minutes after we turn off all the drips. It takes several minutes for those medications to get out of the system, but they're rather short-acting medications. It won't take hours. It's usually minutes. How many minutes? It's hard to say, but I do prepare them that it will not be very long. If somebody is taking a longer time to pass away, we might move them to a separate room in the hospital outside of the ICU on one of the regular floors to give the patient's family more privacy, just because the rooms in the ICU have the sliding glass doors and there's a lot of noise and congestion in the ICU. So if we're able to, we'll move them, to another place in the hospital if it looks like the patient is going to take a longer time to pass on. There are also some situations, but it's very rare, that a patient may transfer to an inpatient hospice facility or go home on hospice care. Some people opt to not be around when we take away the life support. That's normal as well. A lot of people ask, is it bad if I just say goodbye and go home because I don't want to see them like this? And I tell them no, it's a personal decision whether the family wants to be around or not. So we let everybody have the option of being at bedside when we take away life support. Some people will step out while we're actually removing things and then come back in, or they'll stay for the whole time. Or, as I said, they might opt to go home. It's a very personal decision, so whatever the family is most comfortable with, or the person who is visiting the patient, then we honor whatever they want. Something else that I'm asked frequently is if the patient's going to wake up when we remove life support, and many times they don't. If they are already in a coma or if they're sedated, they're on a lot of blood pressure medicine. Sometimes their blood pressure is just so low that their brain's not getting enough blood, then they're not going to be able to be awake and alert. Many times people are just in a deep sleep and they pass away that way. I think a lot of people worry that there's going to be a lot of suffering when we take away life support. Someone actually recently asked me if the death is going to appear violent or aggressive, and I said no, not. It's not typical at all that we see somebody struggling at the end of their life. Most people, like I said, are already slipping into a deep sleep, and if we see any sign of pain or anxiety, then we do give medications to treat that as well. Some people ask if they're able to take their loved one home when we remove life support, and unfortunately the answer is typically no, because they will not survive the journey home. I know I said that home hospice is an option for some, but for most it is not. Typically the patient is expected to die within minutes to hours of removing life support, so there's a high likelihood that they will die within the hospital prior to even having the opportunity to go home. If you have any questions about this process, please leave them below. I will see you for the next video.